joining us in this session of our Advancing Health Equity Together seminar series. For anyone joining us for this first time, this is really an opportunity to learn about the basics of community engaged research, learn from others about their strategies and approaches to conducting community engaged research, but also really like a chance to reflect on how you're able to implement some of those strategies and practices into your own programs and research. This is our third session in this year. In our first two sessions, we've talked about like how to establish a community board to really inform like your research throughout the research life cycle. And we've also talked about the importance of engaging in intentional reflexivity in both qualitative and quantitative research. Today, we're going to talk about strategies for engaging communities when dealing with difficult topics. We have an amazing panel with us today. We're gonna start with like a panel conversation, and we'll dedicate the last 10 to 15 minutes and open it up for Q&A. So if you have any questions coming up during the session, feel free to drop them in the chat, and we'll make sure to just go back to them and address them in the Q&A session. All right. As I was saying, we're really like so happy to have such a great panel with us today. I'm going to do their brief introductions, but they're gonna introduce us farther into the work that they do. So thank you so much for joining us, our great panel. We have Kanwal Hack, who's the NYC Partnership Senior Program Manager for Women's Health at Mount Sinai Icahn School of Medicine's Arnold Institute of Global Health, Department of Global Health and Health Systems Design. In her role, Kanwal is responsible for helping design, implement, and evaluate the NYC's team portfolio of CBPR work focused on improving maternal and reproductive health. Kanwal is a medical anthropologist, doula, and co-author of Taking Care of You, The Empowered Women's Guide to Better Health, and the founder of TCY Women, which is a nonprofit helping women navigate health and care via education, community, and trusted tools. She earned her bachelor's in biological sciences from the University of Missouri and her master's in medical anthropology from Boston University School of Medicine, and is currently completing her PhD in public health at the University of Texas Science Center. Thank you so much for joining us, Kanwal. Second, we have Daniel Reyes, who's worked in the nonprofit sector for over 20 years. He began his professional career as a high school Spanish teacher before moving into social services, working in youth development, children and family services, supportive housing, emergency food, immigration, and economic advancement. Most recently, he served as the Chief Program Officer at the LGBT Community Center in New York City. He previously served as Executive Director of Junta for Progressive Action in New Haven, Connecticut, as a Deputy Executive Director at the New York Common Pantry. His experience in strategic organizational development, program design, metrics and data analysis, fundraising and events, and as well as executive leadership development. Mr. Reyes is also a member of our Catalyst board member at the Institute for Health Equity Research. Last but definitely not least, we have Autry Hassan, who's a mental health counselor at Saki for South Asian Survivors, which is a New York-based nonprofit rooted in a survivor-led movement for gender justice that provides culturally responsive, multilingual services for the South Asian and Indo-Caribbean diaspora. In her role, she offers trauma-informed individual therapy, leads workshops about sex education, trauma, and intimacy, and co-facilitates parent support groups focused on acknowledging the impact of generational trauma. Autry earned her dual master's degree in mental health counseling and psychological counseling from Teachers College, Columbia University, and her work centers on creating survival-led spaces for healing and dialogue around difficult topics. Again, we're so excited to have you here. Thank you so much for joining us. I'm just going to have you now just give us a more in-depth presentations of the work that you do and organizations that you work with. And Kanwal, if you want to kick us off, that'd be great.
Sure. Sorry, can you repeat the question one more time?
Just introductions, anything I haven't covered in the brief bio, or like if you want to give us more context with on the community engaged research work that you do.
Sure. Yeah. And I think like just overall kind of maybe a more human introduction rather than background and degrees, because I think usually when I'm doing work in the community, I kind of try to like introduce myself as a person and kind of what I'm like. And so I usually say like I'm a pretty goofy person. I like to have fun. Don't take anything like too seriously. And I love to learn. So I'm really a nerd at heart. And I'm also, fun fact, like I really love the movie Mean Girls. And so I have my Mean Girls cup right here next to me. But one of the sayings like I like to say is that I wish I was a combination of Mrs. Frizzle from the Magic School Bus and Miss Honey. But I really think I'm Tina Fey from Mean Girls whenever she says, I'm a pusher, I push people. And I think I resonate with that so much, especially like in the type of work that I do, because I think as a researcher, one of the things I'm really passionate about is like systems around health equity and like why do certain people have access and others do not, and how do we kind of create more fair systems, more equitable systems. And so I often feel like I can come across really critical, but it's and I think it can be interpreted as like pessimistic or negative, but I really think I'm very optimistic and I think we can do better and we should do better. And so I really resonate with her phrase of like, I'm a pusher, I push people. And so usually I kind of like just, do that kind of framing whenever I'm talking to folks, because I'm like, hey, I'm going to be asking a lot of questions. So let me give you all of this context about me and kind of what I'm bringing to the space and what I really care about before we move forward. But yeah, that's like the intro that I usually like to give, rather than my academic one. And can I popcorn it to Daniel?
Sure. Hi, everyone. Daniel Reyes, he, him pronouns. Yeah, I like that. I actually, I've been doing this for a very long time and doing in human services and advocacy and program development, organizational development. Right now, I'm currently serving as a consultant on the New York State Department of Health's LGBTQ needs assessment. It's a 5-year plan project that will kind of help the state identify what changes in the Department of Health and other agencies need to occur in order to ensure that the community has what it needs to live their most authentic life successfully. But I do think that on a personal note, I think the career choices that I've made over the years have been very much reflective of pivotal moments in my life, like being a teacher or working in supportive housing and emergency food, and being as a gay man working with the community is very important to me. But I think now things have changed over the last few years, and I'm a proud dad of twins with 2 moms, and we're a big queer family. And I do think that a lot of what I'm doing now is to ensure that the world that my children are going to grow up in is the world that they want and the world that allows them to live their life without prejudice or stigma. They're 8 right now, but we also know that the world can be very cruel, and 2 mommies and a daddy can be a challenging thing for kids. So I want to create the world where they can live their most authentic lives as well. So, and Atri?
Oh, thank you so much. And congratulations, Danielle. That sounds so wonderful. And Kapil, I really love you bringing up, okay, who am I? More about my academic work. But I think I would like to share of what kind of brought me into this work in mental health and social services. So I grew up in Bangladesh. And growing up in Bangladesh, we didn't have a lot of access to mental health. And then when I moved to the US, I in for a shock, not a lot of access to mental health either. So I think like working at and I'll say a little bit more about Saki. I think I kind of tried to heal a childhood part of me where I am providing the services that I kind of wanted as a child and now as an adult, of providing culturally rooted services, providing access to gender-based services. At its core, Saki is really a survivor-led movement for gender justice. And we do this through our amazing programs. We not only provide counseling services, is what I do, but also case management, navigating legal systems. For a lot of immigrants that we work with, the legal system, the language barrier is so difficult. And for us to be part of that has been really eye-opening for me. We also provide economic empowerment services, including navigating HRA, finding jobs. We have a youth empowerment program, a housing justice program, as well as our food justice and community engagement program. And I think, like, when I look at the work that I've done over the past 2 years at Saki, it really is about the community. It is about us coming together to work so that we can live in a world that is now, we can live in a world now that is better for us. And I think every day we're moving towards that. I know currently things are looking doom and gloom, but like being there for each other, being there for the community has mean a lot to me. So thank you. Excited to be here.
Thank you for the introductions. As you've all shared, I think we all share the common interest of just making access to healthcare and other services to, the people and communities we work with. Before we jump into the questions, I just want to remind everyone that you can drop the questions as we go in the chat, and we'll go back to them later. But I think this is a good time to just kind of pivot into our questions and the panel conversation. And Autrey, I'm going to start. I have a question for you. As you've all kind of alluded into, like your brief introductions, difficult conversations can look different across contexts. It can be like reproductive health, trauma, or sexuality. What common strategies have you found effective in opening space for dialogue to even just get started?
Um, I think what has really worked for us is building that relationship and building the rapport. As counselors, we see a lot of clients in individual settings where we're able to build that rapport and kind of get the pulse of what survivors want to hear. And then we bring it into groups and we're like, okay, here's the space. And we do a lot of group building, really like getting to know each other. I think the first conversation you have in the community cannot be about, okay, let's talk about trauma. Let's talk about sexuality. I think that is really jarring. So we oftentimes start with, okay, tell me about your favorite memory of summer. Tell me about what food do you like? And I think really building that relationship, and also for us naming the discomfort in the space. The group that we led, it talks a lot about sex education. And we can name it. We can name the fact that talking about sex in our communities is a taboo topic. It is not comfortable. Oftentimes, we'll name our own discomfort. And it's true. It's as uncomfortable it is for the survivors, it is also uncomfortable for us, and showing that we're here with them. Another thing that really helps is actually being honest and transparent. When we're having these conversations, we're really talking about really difficult topics. And we want to let the survivors know that, okay, this is the reality. We're not going to sugarcoat how reproductive rights are in this country, how trans people are treated in this country. So really being honest about the situation at hand has been really helpful because, they know, even if we don't name it, they know, but naming that really builds that trust with us. And the last thing I will say is really meeting people where they are. Some people are not ready to have conversations. Some people are, and really meeting where they are, what they want to talk about. We never want to impose kind of our agenda, quote unquote, on them. So really asking survivors, okay, like what do you want to talk about? What about this topic is interesting to you? And trying to start the conversation there rather than somewhere else.
Thank you so much, Audrey. That was really helpful. And I think what you said around building relationships and being intentional about establishing a rapport, but also getting to know people at a personal level is very important. And I liked how you said that it's important to name that discomfort, not just like sugarcoat it. And Danielle, on like still talking on that topic, this next question, communities often carry histories of stigma, mistrust, or even harm. So how do you begin conversations in ways that honor that history while also still moving forward the dialogue?
Yeah, I mean, I think it's just a continuation of what Audrey was saying, is that it really is the one-on-one conversations at first. You can't like have a community-wide meeting. Let's all talk about what harm we've all done, because it's just not going to be successful. When I started at the center, one of the things that I was doing was really trying to understand the program portfolio, the utilization, and also the exterior perspective or perception of the organization. And so really understanding that a 40-something-year-old organization is going to have lots of history, to do lots of really good things, but also to cause some harm. And to own that is really important. We don't always get it right. Organizations are filled with human beings who are imperfect to begin with. So, I think that's what's really important to keep in mind. And so, at one point, there had been a long history that the center, even I held this perception that the center was a place for cisgendered gay white men. And when I went through the recruiting process and began to know the people, I was like, oh, well, that's not even the case. But that was something that was seen by many people, especially communities of color, and the trans communities of color, who really have had experienced harm. And one of the things I set about doing was to really get to know the leaders in the movement, the leaders who have long history with the center, and who hold tightly to the harm and the mistrust and the things that have been done to them. And so I really went about, one, getting to know them. So that was the first thing. I wanted to share who I was. They shared who they were, and you really give the moment for people to kind of ease into, well, so you're from the center, and inevitably they want to share something, and they want to be given the space to share it. And so my perspective is that you are the representative of the organization, and you carry not just your role, you carry its history, its reputation, you carry all of that with you. And in this moment, with that one individual, you are the organization. So it's important to keep that in mind. And so really being able to give the space to let them share what the harm was, to validate it, and for the organization to actually own it, that yes, that indeed did happen, and that and to apologize for it. I mean, I think that was the most several times people were like, this is the first time someone for the center has apologized to me, for what had happened to them. And so being able to do that, and to know that this isn't going to be the only interaction, and to know that we're going to establish a relationship, and then kind of going into overdrive and doing that with multiple people in this iterative process, until there's a space where maybe groups can come together and they feel safe with people from the researcher or from the organization, and that the real dialogue can happen. And then to explore, how do we move forward? I think that's the other piece. We don't want to get stuck in like what has happened. We understand, we want to kind of like give the space for it, the healing for it, but we also want to know, how do we move forward? And that's what community can share with you in order to make sure that we're all on the same path together. And the other thing is that, like, it's understanding that there are multiple routes to the same destination, and that's okay. And it's okay for us, as long as we all know where we're heading, then we'll be okay. So it's really being able to provide that space to be able to have the agency to own whatever it was, and to figure out how we all move forward. And I think that's not one interaction. It's kind of like an iterative process that happens over and over. And there's still going to be bumps in the road. It's just always going to be that way. And if you make that bump, everybody in that community is going to go right back to what happened before. So it's always in knowing that if that indeed happens, then the work has to be done all over again, and understanding that it didn't take days or months, it took years, even decades, to cause this harm. And so we have to be able to kind of like know that healing process and the ability to move forward is not going to be a straight line forward.
Thank you so much, Daniela. That was really informative. I especially loved how you emphasized not only like acknowledging but also owning the histories of organizations, and that, you know, like validating people's hurt and trauma is really the only way forward. Yeah, I think we definitely need to practice more of that in all of the work that we do. And Kanwa, I'm gonna pivot a little bit and talk about your projects at Sinai now. So in your Hope and Hope Growing programs, you address deeply personal and stigmatized issues like reproductive justice, housing insecurity, and justice involvement. What strategies help you create safety for participants to share openly?
Sure. So maybe I'll just give a little bit of background first on both of the programs and then talk about safety. So I think, so the HOPE program essentially was started, I want to say 3, maybe almost 4 years ago now. And in theory, it should be that anyone who's coming into the public hospital systems in Queens, so Elmhurst Hospital or Queens Hospital, can get a doula free of charge anytime during pregnancy up to 1 year postpartum. And, you know, as we started implementing this program, we found out that a large portion of the community members we were serving were facing housing insecurity. So that could look like often it was crowded housing, sheltered housing. We didn't have as much street homelessness, but primarily the first 2 categories. And so really here, you know, kind of identifying that this is a large majority of our community members, and we need to provide more specialized support and care. And so that's kind of how Growing Hope, the second program, came about, so that we could provide that type of care, more resources, you know, like access to like more doula visits, different types of support. And also Growing Hope, we also incorporated the justice involvement piece, because folks who are incarcerated at Rikers Island, they come to Elmhurst Hospital to give birth. And so this was another subsect of our community that we wanted to provide more specialized support for. So those are kind of overarching, just like the programs and like who we're supporting. But I really think that when it comes to safety, when it comes to trust, like some of the things that we did before, you know, we kind of saw, like, as researchers, like, oh, this is what our data is showing us, right? And now we want to provide more specialized support. But before we do that, right, who are we going to talk to? How are we going to think about moving forward on this? And so we do not really move forward on anything without advice, like without meeting with our community advisory board, which meets monthly. Like now we've just recently moved to bi-monthly after like several years. But here we have folks who have lived experience, whether they've given birth while incarcerated, while they, if they've given birth, you know, while in sheltered or in crowded housing situations. So we have folks with lived experience. Then we also have providers on our community advisory board. So, you know, physicians at different levels, residents, attendings, nurses, nurse practitioners, PAs, and then leadership from the hospital as well. And then we also have a lot of folks who are on leadership, or they are a part of different CBOs, so community-based organizations that are providing resources, right? So like Saki would be an example of a CBO. And kind of really working closely with this group of people. So one, bringing people into the same room, because we're serving the same community members, but we're providing different things and we come with different perspectives, right? And so oftentimes there's like, you know, there can tend to be conflict between these groups as well. So creating a space for us to really talk about, you know, what is our shared vision and goal, that we are all here to serve our community members, and what are we bringing to the table, right? And so making sure that these different expertise can coexist and work together, and how do we kind of like where do we bridge the tension? And I think like as Audrey was saying earlier, like really being able to name the discomfort and the tension and like these, you know, like, yeah, these are the problems, these are the challenges. We don't always get along, we don't always see eye to eye, but you know, we are all working towards the same goal. And so that community advisory board is like crux in terms of developing a plan, you know, coming back to our community advisory board when there are challenges and so on. And then we have a smaller board that like meets every week, that's made up with leadership from the hospitals, from our doula organizations, and hospital leadership. Sorry if I just said that, but we meet like weekly because there are challenges that come up that are more immediate, you know, where we can't like wait a month. And so if someone needs care, they're having access, you know, trouble accessing, like getting into the hospital or getting matched to a doula, so on. And so that's kind of like short term. And then we will bring back those issues to our community advisory board. But really that helped us kind of frame who's a part of the solution, right? Making sure that we have different voices represented. And then we went about kind of doing more in-depth partnerships. So with shelters, who were already working with different organizations with, that was like a lot for our housing insecure populations, working with local shelters. And then we kind of started with like, here's different shelters in the area, and then kind of narrowing it down to like really where are the patients from Elmhurst, you know, where are they living, where should we focus in there. And then we had folks on the justice involved side. We had community partners like WJP, Women's Justice Project, that have been doing this work for a very long time, and having members from their organization join and help us, because we are not, I think one of the things as researchers is like, yes, we quote unquote like have an expertise, but we are not the experts when it comes to the communities that we are serving for. The community members are the experts, and how do we honor that, right? And so what does that look like in terms of listening? What does that look like in terms of time? What does that look like in terms of compensation? And so making sure all of those things are considered, and that we're bringing people in, you know, who actually have the expertise, right? To lead us and guide us. And, you know, also be able to tell us like, hey, like this is not the right approach, and steer us in the right direction. But I think kind of putting all of that together was like our first baseline of creating trust and safety. And then it really, I think, Daniel had mentioned this earlier too, but it really starts with building those relationships. So is there safety in these one-on-one relationships with each of the organizations? How are we talking to each other? Do we have ground rules? What does it look like when conflict arises, right? Like, because inevitably it's going to arise, and you know, it's actually a good thing, because that means we're working through different perspectives, we're working through different challenges. And so like the thing I would say is that I think even in building trust and safety, it doesn't happen overnight. Like it takes years, and we maybe go through different levels. And so like we've had different times where we have learned, you know, maybe we didn't communicate in the best way, or maybe we didn't have the best ground rules or practices laid out, and like owning up to that, and you know, saying sorry for not you know doing it in the best way, even though sometimes like, you know, we like to use the analogy of like we are oftentimes like, you know, building the plane while flying it when we're implementing and building programs like this. And it's hard, but acknowledging that, you know, it won't be that it's just going to be like this seamless project, but it's like we constantly have to iterate, reiterate, and learn, and then like own up to our mistakes that we inevitably are going to make in this process. And I think part of that, like owning up and being transparent about that, is what's building trust and what is building safety, because then folks can say, you know, I didn't like this, or, you know, this didn't work, and they feel safe enough to be able to express that. And I think that's when you kind of start to realize we're moving in the right direction. But I would say, like, overall, those are kind of the basics. And it, like, timeline wise, you know, it's going to take at least 2 years before we're going to get to that point where people are really starting to feel comfortable sharing. And I think that's one thing sometimes, like, in grant funded projects, we're kind of like racing to, like, you know, finish things and like get to this, but that's just not how things work. And if we want to build things that are sustainable and truly grounded and rooted in community, it's gonna take time. And we have to like really acknowledge that reality.
Yeah, absolutely. Thank you so much, Kanwal. I think a lot of what you mentioned about like this not being a linear process and that it's okay to really learn from mistakes and lessons learned. And it can vary depending on like the communities we're working with. And that takes us to our next question, which is for Autrey. What does culture, and that could be whether, you know, like rural or urban, faith-based or ethnic identity, play in shaping how community get engaged in difficult topics?
Okay, I think when we talk about culture, especially because Saki works with survivors of violence, the culture around that is oftentimes silence and shame. And really addressing that and really knowing the audience that you're speaking to is really important, because oftentimes many survivors we work with, they might not see violence as a problem, violence or coercion or any of this as a problem. And other parts, other things that we talk about in terms of sexuality or sexual or gender or pleasure, all of these things for them, because of their religious beliefs, could be something as morally wrong. And I think we approach it as a way that, okay, these are the expectations and beliefs that survivors have that we're working with. And our goal is not to change their beliefs. Our goal is not to challenge them or make them change their mind, but just to provide them with a different set of information, just to, you know, for them to realize, okay, there are things that could be done differently. And this is, okay, what you believe in is, all right, this is what you believe in, and this is the information we're providing. And something that we've actually found in our work is people are more open-minded than we give them credit for. And oftentimes addressing our personal bias of what culture is or what they might believe is really important. For example, when we did a group on sexuality and gender. And I honestly thought that people would be really against it. All of the people that we work with are primarily Muslim, much more older immigrants. So I went in somewhat with a mindset that, okay, this is going to be a fight. But honestly, I think like I had co-facilitators who drew me out of that, and the participants really opened my mind and shocked me, honestly, to because they're so much more open-minded than we give them credit for. And they really took it in stride. And I think a lot of people come into these spaces with a sense of curiosity. And our goal is to also meet them with that sense of curiosity and not kind of put in our biases of what they might think. So I would say is that, yes, of course, stigma is a big thing, and there are cultural expectations that communities may have, but that doesn't mean that we can't have a conversation. We can have a conversation of what is different, and provide them with this information. So really, I would say, I think doing the inner work of challenging our own biases of what these things mean is also really important when doing this work.
Thank you, Audrey. Yeah, I think reflecting, like engaging in reflexivity and who we are as people and how we're coming and with which lenses into the research and work that we do is very important indeed. And Kanwal, so if you could share with us one lesson about engaging communities in the conversations people are most afraid to have, what would that be?
I think one of the things is that, like, especially if it's conversations we're afraid to have, like we ourselves can't be afraid to be vulnerable if we're asking people to do the same. So kind of leading with that, leading with why are we doing this, being transparent about it. You know, if there are personal connections, being willing to share that, because we can't expect of others what we're not willing to give ourselves. And I think usually that opens the doors, because at least from the experience that I have and those of my team members, most of us, we have made, you know, careers of this or pursuing this because we care deeply about it. And often it is because we have had similar lived experiences. Something has guided us towards that path, right? It's, and I think Daniel was saying this earlier, like we oftentimes don't have this linear experience. And there are things in our life, and it could be personal and professional, that kind of interweave and that have created, you know, our own personal understandings and our own personal kind of like light for where we want to go and what we want to do, and being you know, just being willing to share that. And I think that's why, like, for me, it's really important of like, this is who I am as a person, this is the context I'm bringing, and kind of breaking down as much as we can some of those power dynamics that happen, especially as researchers, of like coming in, you know, you may have like a hoity-toity degree or, you know, letters behind your name, whatever, but in this space, that's not what we're talking about. In this space, what are we connecting on? And how are we creating equal footing so that like we can learn, you know, and you know, like what, why we're trying to do that. And usually it is personal. So just being transparent about that, and not requesting of others what we're not willing to do ourselves.
Thank you for sharing that with us, Kamal. Like, I like the idea about leading with transparency and vulnerability. Very important for sure. And Danielle, our question for you, and you've worked across so many organizations over the years. So what should institutions and community-based organizations keep in mind to ensure that these conversations are not only getting started, but they're being sustained over the years?
Yeah, I mean, I think it's important to understand that even if Daniel Reyes, is doing the kind of the work, I'm doing the work for an organization. And so there needs to be a process with understanding that what's going to be the knowledge transfer going forward, what's going to be the historical or the history of what's happened in these recent times. So I think it's you know, when we an example of this is that at the center, obviously the queer and the trans community is under siege right now, and things are very, very difficult. And the center was put in a position where they had to eliminate many roles at the center, one of those being my role. And having the luxury of a few months knowledge is helpful, because what that did was allowed the space for me to ensure that all of the work that had been done with community had a transfer to someone else. And so, like, often you don't always want to do the work in isolation, so you do it in kind of like these concentric circles, and there are ways in which other people kind of are brought into the milieu so that trust is not just connected to one, contingent on one person, it's contingent on the organization. And so one of the things we did was, you know, I did was really make sure that when the time came for my departure to be known, it was very much who were in the other concentric circles, and how is it that we're going to ensure that there's a transfer of the relationship so that the work can continue. And so I think that's what's really important to remember, because people will come and go, right? But the work is of an organization will stay forever. Even bad work will stay forever. So I think it's important to understand that when you engage in those conversations and those dialogues, and as you work with people to move forward, what's the plan for the organization so that it can be sustained. As we all have kind of said, this is about relationships. These are about human beings and their life experiences. And you know, we can all read an article about, like, you know, redlining or whatever the case may be, but it's not until you're actually in front of somebody and they're actually telling you what that lived experience looks like that you can actually understand what all this up here in the ether is talking about. So, and so I think that that's why organizations need to kind of keep the conversations going, figure out ways to make sure that they continue beyond whoever is facilitating those conversations, and how does the organization continue to engage communities so that the relationships can be sustained, so that it's not kind of a decline or a step, several steps backwards, and there's a way to kind of keep moving forward.
Thank you, Danielle. And kind of to piggyback off of that, and this is really a question for the three of you. I think we'd be amiss if we didn't really address the current climate. A lot of many of the communities we work with have concerns around, their safety, privacy, around their data, and even showing up into spaces. So how do we make sure to hold space to make sure that the people we work with continue to feel safe and supported?
I can take a stab at it. So I think one of the things that we did recently was our doulas were kind of coming back and sharing with us on our weekly calls that a lot of their clients were really scared. They were scared to access doula services. They were scared to really, like leave their homes. And things had become really hard, so they didn't want to leave their homes for anything, to go to the hospital, to meet with their doulas, right? And so in all of this, we were like, what can we do right now to reiterate support and care and trust? And so we held a special community meeting where we invited the CEO of the hospital to come and speak about what was going on. And it's like, even this is being recorded, so I'm like scared to say all of the things that I would like to say because it's being recorded. And I think like just acknowledging that, like that sensitivity around, we just don't know. And so, for example, for that meeting, it was completely in person, no recording, no phones, nothing, to talk about different strategies to be able to openly talk about what the fears were for those who attended, and then like also being able to take this information back like on physical papers, right? So like letting go of kind of digital technology, like not knowing what we can trust versus what we cannot, but just being able to then pull in the leaders from our community and say like, okay, these are the very specific pointed questions. Like, what are you going to do if X, Y, or Z situation happens, right? How are you protecting people in this? And then like, what can we do as individuals? And so we kind of curated teams from across New York City who could support and answer some of these questions and provide guidance around, legal issues around access, like what happens, if you're in the hospital. And so, yeah, again, I'm probably like not going to share fully because this is being recorded. So.
Yeah, I would just add that, this is a very difficult time right now for the LGBTQ community, and because we're not just the one thing, right? We're actual whole human beings, and so we can be queer and Black and immigrant, or we can be trans and experiencing poverty and food insecurity. So I think it's very challenging. In the work that I'm doing right now for the Department of Health, the needs assessment is in essence kind of a survey, and then we're kind of aggregating that data, and it's ongoing. But the three top issues that keep coming up is the state government overreach, criminalization and policing, immigration, and access to healthcare, which are the three top things that seem to be whirling around us in our immediate environments. And so it's very, very challenging. So it's about understanding that as you engage with people, these are the things that are omnipresent in their minds and in their hearts and in what they're feeling. So it's like really important to know that like we as an organization have the responsibility to create the safest environment possible. And, whatever that looks like, whether that's, the center is a community center, it's an open space, but we had to put signs on doors that saying that this is a private meeting room. You can't just come in here in case we get raided, constantly letting community know what we're doing to ensure that they're safe when they're with us, and also meeting them exactly where they're at. So how do you have a hybrid meeting? So if someone is just not ready, that's not the space they're in right now, how do we meet them electronically or through a video so that we can kind of work through what they're dealing with so that they can, not be completely immobilized and not completely overrun by fear. But that's not an easy task. And it's just very much, it's going to be like this for a while, and I do think that, like, the more we kind of understand what the community is facing, and how we can kind of fight back as much as we can and create as much of a safe space as possible, I think is really important, so that the community can at least find some semblance of stasis or normalcy in how they live their lives.
Thank you so much for sharing, Daniel and Kawal, and I completely agree. And what Daniel was saying about is we're not just this one thing, right? The intersectionality of people's identities are so important to know and for us to realize. For a lot of our survivors, not only are they immigrants or people of color, they're survivors of violence, and many perpetrators will use the current climate to further cause harm. So many survivors will receive threat from their abusers that, oh, if you do something, I'm going to report you. And that is something that we've seen a lot increase a lot more in the current climate. What Sakhi as an organization has done, and again, like Awal said, it's hard to share because this is also being recorded. We're also in the digital space right now, is that we've tried to do a risk assessment of all the survivors that we work with. Who are the most vulnerable? How do we reach out to them? We've also tried to create, our offices are not, where the offices are not public knowledge. We only provide our addresses to the survivors specifically who we work with, so that they're able to access the office. We've done a lot more in-service work so that if they, for example, feel unsafe, they can at least come to our office where it is a safe space for them to be in. And really just naming the discomfort, naming the current climate with them, especially in therapy, we can hold space of and talk about what are some of the coping skills we can do. And for a lot of them, I think even though it is really scary, for them to be in community is really important. So as much as possible, getting them connected to the other survivors, getting them connected to resources. In the beginning, we did a lot of Know Your Rights outreach in different languages that survivors could access to. And I think that has been really important for them to know, because really, like, this information is not widely available. It's not accessible in their language. So what as Sakhi we've tried to done is really meet the survivors where they are and be as accessible as possible, whether in providing space or making sure we're translating materials so they understand what the current situation is. Yeah.
Thank you so much. Those are all very valuable lessons, and really honoring the space for meeting people where they're at and continue to be the safe spaces that they actually need right now. I'm gonna transition us into the Q&A session now and just really allow anybody to share any questions they may have.
I have a question. If I didn't want to jump into, but we had a little silence. I thank you all so much. I mean, for sharing all of the wisdom collectively that you have. I did notice a common theme that came up when all of you were speaking around acknowledging harm, acknowledging mistakes, and owning that, and that being a big part of trust building. I was wondering, and I thought of this, Daniel, at first when you were talking about sort of like, I'm not just me, Daniel, I am the organization in this moment in the eyes of the person who had that harm. I totally agree that acknowledging that is essential, but I was wondering what you personally have been able to do to not protect yourselves, but there might need to be some resilience around acknowledging that harm and not taking it all on as, like if you're apologizing for what somebody else did or, something that happened in the past, sure, that has to happen, but how do you not internalize that and then let that sort of guilt paralyze you sort of in moving forward?
I can't say as I internalize it. It is helpful for me to know it helps me figure out how we chart paths forward, So I do think that um, I guess because I have much of the similar lived experiences, I mean, an immigrant, I've experienced a gay man who's, all of these things, it's not the same, but it's similar. And so I guess in that sense, I feel more connection to the individual than I do like that it's weighing heavy on my heart. It's more like, oh, it's like we're not alone. You're not alone and I'm not alone. And in this moment, like um I don't need to I'm the representative of the organization, so I want to give you that space. And I think that the thing that I'm getting out of it personally is that it's helping me kind of draft the strategies on how we're going to continue to do the work and how we're going to engage the community. So um I might just also be just an old school Gen Xer who deals with the resiliency differently, so who knows.
Oh, this is not related, but I want to actually, Fatma put something in the chat, but I just wanted to shout out Fatma because she is one of our doulas from like our original Hope cohort. So she's also a social worker, so she's supporting the community in like many different ways. So shout out there to just like the intersectionality of our work and just being in these spaces, and wearing different hats.
We do have time for one more question.
Hello? Oh, can you hear me?
Yes.
Oh, okay, hi. Hi. I just wanted to say it was really lovely hearing all about you and your programs, such initiatives. And it was really wonderful knowing that these programs do exist. And I just wanted to ask like two questions, if that's okay. One is like, if you're comfortable sharing, and anything we haven't mentioned yet, like gaps that you see within current research or initiatives and that you hope to expand and improve on. And then along with that, you know, with time and leadership position changing, like how do you help your organization or the programs you're working with and the you're working with continues to expand? And an example could be like going out of state, conferences, movements, etc. Let me know if that makes sense.
Thank you so much, Amna, for your questions. The first question was about the gaps in research or the gaps in services we're seeing, and the second was about with the changing leadership, how are we addressing that, if I'm correct?
Yeah, kind of like, wanting to expand and continue to support these communities and like passing that on and like how do we hope to continue that, if that makes sense. Like continuing the legacy essentially.
Yeah, I can take a stab at it on both those questions. The first thing I would say is actually very connected to Kawal's work. I think the current gap that we're consistently seeing is we have been getting an increasing number of pregnant people who have experienced gender-based violence, and this is not a population that I've, at least in my work, haven't seen discussed about at all, or the resources that they might need is different or more than the resources we're currently able to provide. So there's a huge gap, I would say, for providing services and resources to pregnant folks who have experienced harm, because they might not be ready to leave. They might not have the ability to leave right now. And what research has currently showed us that in terms during pregnancy, the risk of violence increases. But how do we help those folks? I think I struggle with that. I struggle with concrete resources that we can provide for them. So that is something that I've seen the gap in. And to answer your second question, I think it's a difficult question. Not to ask, but to answer. I think currently what we're doing is, yes, we're going to conferences, whether it be more engaging in our community leaders, state representatives, New York State. We work with a lot of council members as well to kind of raise awareness, as well as trying to get more funding for the work we do. And I think something Daniel mentioned is making sure that we're sharing the work, right? So somebody else bringing in other people into the work is really important so it doesn't die with us. People change, leaderships change, to making sure that we're sharing the knowledge with the larger community is really important to continue the work.
I was just gonna add to that. I think for me, like, I usually say like reproductive health, maternal health is my 9 to 5, but then my 5 to 9 is everything beyond boobs and tubes when it comes to women's health. And one of the things that we're working on through TCY Women is really just building a community and creating a space where people, we actually have folks from all over the world that are a part of our community right now. And just being able to share in ways like what we're feeling, what we might be going through, and sharing strategies for taking care of ourselves. So that's TCY stands for taking care of you. And really, how do we prioritize that, and how do we continue to prioritize that, especially when it feels really hard to do so, and it feels like everything is working against us, like, policies are being taken away, resources are being taken away. But how do we continue to be resilient, uh, and, show up like for ourselves, right? Whether that could be something like, hey, I ate breakfast on time versus like I wrote an op-ed. It can look very different from person to person, and just like celebrating our wins and being able to talk about when we're facing barriers so that we can help each other through those times. But really, again, it takes like, it really does take a village to move through these phases of life. In different ways, we need different expertise, we need different support systems. And so how do we make it not a one-time thing, but something that's continuously supporting us as we face new challenges? So yeah.
Thank you so much, our panelists. It's been another great session. You've given us a lot of food for thought and definitely a lot of encouragement to continue doing like the work that we do too. I do want to acknowledge that we're on time, but please, please, please make sure to fill out our feedback form. It's really important to, help us understand like what we're doing right, what we need to change, and if there are any other topics you want to hear about, like in our future sessions. So I've dropped the link in the chat, but I'm going to drop it here again. And make sure to also register for our next session, which is on November 19th. And it's really going to be exploring the role of AI and what it means for health equity and community engaged research. Thank you so much, everyone.
Thank you.